Okay, our last speaker, and then after this speaker, like I said, we will go into questions and answers. I would like to introduce Patricia Black. She goes by Pat. And Pat Black is an outcomes manager for patient care services at the Children's Hospital of Philadelphia. She is responsible for nursing, ambulatory nursing, scorecards and dashboards, metric development, and magnet reporting. Pat has worked in some of the nation's first institutions, including, of course, Children's Hospital, our first Children's Hospital, but also she's worked at Temple, and she's also worked at many other facilities in the area. Pat received her Master's of Business Administration in General and Strategic Management from Temple University's Fox School of Business, and her Bachelor's in Business Administration with a concentration in Management and Marketing from the University of Pennsylvania's Wharton School of Business. Pat recently presented Getting the Maximum Value from Your Dashboard at the 2013 International Quality and Productivity Center Performance in Excellence in Healthcare Symposium, in Chicago. And again, she has presented and co-authored at many other conferences and presentations. And with that, I'd like to introduce Pat Black.
Thank you, Patty, for that nice introduction. Good afternoon, everybody. Okay, so today I'm going to take you through the journey of our nursing scorecard, our data, our outcomes, and our engagement of our nursing, and also our cultural change at the Children's Hospital of Philadelphia Department of Nursing. I think we've been so fortunate today to hear so much good information about health information, health informatics, and the associated challenges as well as advances there. And nursing outcomes has gone through some of the same things in terms of advances and challenges, and I'll be able to share that with you. So before I begin, I just want to give you some highlights about CHOP for those who are not as familiar with CHOP. We've been around since 1855. We started as the nation's first children's hospital at a time when children were treated at home because of the risks associated with bringing them into the adult healthcare environment. We are approximately a 512-bed facility. We have over 3,500 nurses, over 400 advanced practice nurses. We have nearly 50 ambulatory sites, which makes us the largest pediatric healthcare network in the United States. You probably know that we are magnet designated by the ANCC, and last but not least, we're ranked #1 by U.S. News and World Reports for the best children's hospitals. So when we're looking at our outcomes, we're largely focused on the nursing sensitive indicators, and you might wonder why we focus on them. And that's because we want to put a number on the contributions that nurses make in the outcomes of patient care. And if we have a number and we compare that to our benchmark, we're able to see any changes. And if we notice that number is coming down a little bit, we change our improvement plan to result in better outcomes for our patients. So again, I mentioned I was going to take you on a journey. This journey for me started with nursing in 2011. We did not have a scorecard dashboard for nursing, and so some of our goals were in trying to establish one to have a structure to keep us aligned with the hospital operating plan, because we all know you can have some great ideas, but if those ideas are not going along with the institution, you're almost, quote unquote, wasting your time. We wanted it to be a tool for tracking our progress on our improvement initiatives, so we had one point of reference to go in and look and see what the improvement work was associated with our work. We wanted it also to be a repository for our magnet data, so we can quickly go to one point of contact and get that data out quickly to make our magnet submissions. And we wanted it to be a vehicle for transparency, which means neurology could look at oncology's information, and the health, environmental health people could look at it just as easily as our CEO. So on our scorecard, we have basically 4 major categories. I won't read through all of these. You'll notice some asterisks and some M's. The asterisk means that information is also reported on our ambulatory scorecard, which is a separate one. Then M means that we also are submitting this for magnet. We have our clinical excellence, which surrounds our HAIs, patient handling, and things along that line. And as Bonnie touched upon in our professional engagement, we're looking at vacancy and turnover. Are we retaining our nurses? Are they staying with us? Professional engagement, clinical excellence, those are our satisfaction measures. And then to balance this out, our financial stewardship, we're looking at labor, patient care supplies, and our total expenses and overtime, and seeing how efficient we are with those resources. So phase one in the scorecard started in February 2011. We had to start somewhere. Information was coming from all over the place. So we said, let's find an organized way to capture that information. So we pulled in SurveyMonkey to collect the data. We had 17 project teams. Each of those team leaders was responsible for inputting their scorecard data into SurveyMonkey. Because of the way the scorecard was structured in Excel, we had to then, we, meaning I, had to take that information, transfer it into Excel. And we all know, if we've been through this, that anytime you're retyping or rekeying something, there's a chance for error. And if you've ever worked in Excel, we know about the formatting and the formula changes that went on. So that was not necessarily the most ideal method for us, but we did not have access to IS resources at that time, so that was the best that we could do. We just knew that we needed to get started. In order to have that drill down look, because this was not a software application, I instituted some hyperlinks to move us from the summary level down to the unit level. So here's just a quick look at our scorecard. I'm sure you all have seen many scorecards, and this is pretty standard with all of our initiatives listed on the left-hand side. And of course, we had our reporting frequency, our status indicators, the typical green, yellow, and red. We had our database means, which is an external benchmark where we can go outside and compare ourselves. But the status indicator really related to our internal CHOP target and the current month's actual. So if we wanted to drill down and take a more closer look, for example, if we looked at fall prevention, the next level would give us our team leaders, executive sponsors, historical trends in a graph form, once again repeating the status indicator. And also we asked in the upper right-hand corner that the team leader identify what were some of those factors that either made it possible for them to meet their target, or if they didn't meet it, explain to us why. So that kind of increases their accountability. They also should have improvement initiatives going on and improvement work every month, even if that metric is only reported quarterly. The next level, of course, would be all of our units that reported on that particular measure. And again, we can look through the entire fiscal year and see how they performed. Phase two for us began in November of 2011. We went back to IS and said, what could we do? We need a better way to do this. And they suggested Microsoft Sharepoint, which is web-based. We put our Excel scorecard on Sharepoint, and we gave the team some options. Do you want a designated day to put your team's information in, or do you want to be good stewards and just put it in before the deadline? And the reason why we gave them the option was because not everyone could go into that document at the same time. It was similar to a library book. You know, when it's checked out, nobody else can have access to it. So nobody wanted to pick a date, and you could probably imagine what happened when we gave them the freedom to do it before the deadline. Everybody went in on the day of the deadline. It was kind of chaos and confusion, bottlenecks. There's always somebody that had it checked out over the weekend or while they went to a meeting for 2 days. Nobody can get in. It was painful. It was broken. I got to the point where I said the next person that breaks it has to take me to lunch, and I have to tell you, I increased my disposable income by doing that. But it was all in fun. I didn't make them pay, but that was always the threat. So here's just a quick look at SharePoint. It's sort of like a wiki space. On the left-hand side, you know, we have some folders with a lot of our presentations inside. In the middle where you see the largest circle, that's where a scorecard was, and they checked it out. On the right-hand side, we post announcements of things that they needed to know. We had calendaring functionality as well. So phase three, we wrote a compelling argument or request to our IS services. So we did get consulting resources by this time. We said we need another better way of doing this. They selected ClickView, which I think you all may have heard about in one of the forums here, and that was web-based. It has a powerful dashboard and data analysis, reporting, visualization functionality, and it seemed to be a very good tool for us. IS was able to replicate sort of like the look of our scorecard into ClickView, and we were very pleased with it. We were really happy about the self-service analytics. What that meant was if a unit wanted a custom report with just their information, they don't have to send it to me and I don't have to do it. And it was very easy and user-friendly for them. Like I mentioned, the visualization was enhanced. It can accommodate, this is the biggest thing, many users simultaneously. It pulls data from our data warehouse, which kind of cuts down on errors, and also allows us to upload other information not contained in the warehouse. This is a quick view of the look of ClickView. Same, pretty much the same layout that I told you, just a bit more sophisticated. If you look on the extreme right-hand side and you see the orange horizontal bar, if you click on that bar, you get the comments about the factors affecting your ability or inability to meet your target. You also get a lot of information on the improvement work. This is the second page detailed drill down. This is where you have more analytics capability. Filtering, you can also compare more than one metric on a graph. For example, if you wanted to see the interrelationship between CLABSIs and PIVs, you can put those on the same graph. So again, we're really happy with that, and we also have some canned reports in that as well. So some of the tools of engagement and keeping our nurses engaged in the outcomes work. We have some things that are not quite as serious as the scorecard or some of the more powerful informatics talks that you've heard about today. We have what we call Scorecard News, which kind of highlights on the front page of the newspaper those initiatives, scoring in the red, yellow, and green. We have write-ups about every nurse that's presenting at a different quality or safety forum. Coming down the pipe represents changes that they need to know about processes, and I find that you really have to keep them in the loop, so that's a good vehicle for that. We have a crossword puzzle, which forces you to go to the scorecard, not just look at your information, but that information of other initiatives in order to answer the questions. And in a serious environment like a pediatric hospital, you want to keep it light sometimes. So we also have our Sometimes You Gotta Laugh page, which has a cartoon. We have unit display boards on all the units. In order to fill that out, the nurses need to go to the main scorecard and see what the main metrics are and put down what their unit has scored. And that kind of keeps them engaged and focused on the different outcomes work. We have other tools we call Bedside at a Glance, which is a bar graph, and it's in descending order, so you can see if you're contributing to the score, where do you fall, like in that category of information. We take frequent surveys. We have contests even with our scorecards with little prizes. And on the right, it might not seem too sophisticated and maybe might seem silly to some, but we even have the scorecard wheel of knowledge. It's almost like a wheel of fortune, and we can take that to different forums. They could use it at staff meetings, but once again, you get on a certain topic, there's question cards, and it kind of keeps you engaged in learning more about all of the initiatives. I can't say enough about senior leadership support, which has helped us with our outcomes, trying to not get stuck in the PD and the PDSA cycle, planning and doing and never actually rolling it out. I say don't spend too much time on that, and to also give your users a voice whenever possible in user group meetings. Promoting the scorecard at all the forums that you see listed here. I can't say enough about the partnerships and collaborations that we've had. We collaborate a lot with the Office of Patient Safety and Quality. They have been instrumental in our rapid cycle improvement work. They also help with the driver diagrams and aim statements. They have a lot of specialized knowledge there, which we partner with. They also will help us with small tests of change before we're ready to spread that information. They also can share data with us as we do with them. We have a performance improvement coordinator who is a nurse that goes out to the teams and kind of helps them with their outcomes from that aspect. And of course, our IS consultants, they really advocate for us if we need additional technical assistance and maybe not have to go through the whole process again when we want change. And they also have access to data that we don't already have, so that's wonderful too. Shared governance committees kind of help us with trying to tailor our presentations so they're meaningful to the various audiences, and that's fantastic for us. And there are also external collaboratives that we participate in. So here's our journey for culture change. When I first started in 2011, the arms were almost folded. I could almost see it through the phone. It's like, well, why do we have to put data into the scorecard? And then as recent as 2 weeks ago, there were other units in the forum which said, why can't we have our data on the scorecard? So, now they're fighting to get on. So in closing, I just want to say, don't be afraid to hold your partner's hand. Some of those nurses that started out on the bumpy road because they're not sitting in front of a computer all the time, they're at the bedside and involved in important patient care, have gone on to be cheerleaders and trainers and champions for this type of work, moving the outcomes forward. And don't underestimate the value of partnering with other departments, for your clinical improvements. So that is the end of my presentation. Thank you.